Today is really about bringing key members of the community together to work on our three-way partnership between Yeren, the Central Coast LHD and Hunter New England Central Coast Primary Health Network.
My previous job before I retired was as Manager of Aboriginal Health at Nunyara, and the first major project I had was to go see about the development of the first partnership agreement and Aboriginal Health strategic plan. We made sure that we created an equal partnership, so it didn't matter who had the financial resources and human resources. It was all about Aboriginal health, and it was all about the health of the Aboriginal community members and families.
I think this is a huge opportunity for us for the Central Coast region. I think we've got three partners who are very committed to Aboriginal health. I think it's more than just health, it's the Aboriginal community of the Central Coast. And I think we're at a place where we're all clear that we want to do things that improve health outcomes. And really by working together, I think we'll be able to achieve a lot more.
What's really important about it is being able to facilitate a conversation between three partners, their stories, bringing those together and doing it in a way that they can see the value of the partnership. They can see how they can leverage off each other, extend what they currently do, and hopefully that will connect back into the community, change of services, as well as people being able to access better health outcomes.
It's a big geographical area of 80 kilometres of coastline between the Hawkesbury River and the bottom shores of Lake Macquarie and even further inland. And you can't meet all the challenges of the area with just one group, and so you need to work in partnership.
There is not going to be one lead organisation in this partnership, that the partners are equal. And looking at what each partner does and what they can bring to the table, there certainly is a lot of equality there.
There's still a lot of work that needs to be done in terms of closing the gap for the Aboriginal community here based on the coast. So I think the opportunity is great, and I think by having a clear plan, there's a clear direction then for all of the partners and the broader Aboriginal community as to what we can do to actually make some improvements.
I'm honoured that I was asked to attend and come and join these lovely people and try and help sort something for the community, health-wise.
One of the key issues is we need to support Aboriginal people wherever they seek their care, whether that's in the hospital, in Aboriginal community controlled health services like Yeren, or in primary care like general practice. So that's a key aspect of the partnership, and we really want to get that right.
It's about empowering our community to have choice about where they want to receive their primary health care, and also to keep our mob out of hospital.
We have a big population. We have 13,000 Aboriginal people on the coast here. We have one ANS, we have one Aboriginal health service based within the LHD. So we need to work together to make a difference with our Aboriginal population.
We want to make sure that we're limiting the duplication of services where there is some, and we're integrating services and having our people working together to really address the needs of people on the Central Coast. And it's really about Aboriginal people, it's about the Aboriginal community, and that's where our focus needs to be.
And as long as we all think about the community member and the health and why we're there and how we can make it happen, then there's nothing we can't do.
It's exciting to be able to work across the three organisations to ensure that we work towards closing that health disparity gap for not just the region, but as Aboriginal people nationwide.